I'm now inviting Dr. Triranjan Basu to speak about the PARTIQoL study.
So good morning. This is to be done by Dr. Sayan. Unfortunately, had some personal emergency, so he could not be here. So excuse me for any missing out on critical analysis. I've just gone through the slides now. So this was PARTIQoL was a phase 3 randomized to compare between proton beam versus photon by IMRT. And to hypothesize that we know by proton beam we can have improved patient reported outcomes based on some previous data. So they tried to compare, but compared with a standard dose fractionation most of the time, taking intermediate to low risk prostate cancers treated either by proton or by IMRT without the hormone therapy akin to the PACE trial. Then they were stratified as per the institution treated, the age, the use of rectal spacer and fractionations, long course. Both were long course. One is standard 79.2 in 44, standard as in at that time, versus a bit moderate hypofractionation of 70 gray in 28 fractions. The participants were allowed to assess the patient reported outcomes of bowel, urinary, sexual functions for about 60 months, which is a good follow-up after completion of radiotherapy. The primary endpoint was to compare changes from baseline in bowel quality of life using the software scores and at up to 24 months, and secondary objectives to compare the urinary, sexual functions and the efficacy endpoints as available. So it was between June 2012 to November 2021, so a long study duration, about 450 patients from 30 recruiting centers, well balanced between either of the treatment modalities, and with a good median follow-up of 60.3 months, and 424 patients were still alive when evaluated at that time frame. The median age was 68 years with a huge age range. 59, so majority of the patients had intermediate risk disease. About 2/3 received hypofractionations, about half received a rectal spacer, about half received proton beam using the pencil beam scanning. So there was in bold, this is all done by Dr. Sayan, there is no difference between the proton beam and IMRT in terms of mean change of healthcare software bowel score at 24 months with both the arms. Only a small clinically non-meaningful decline from baseline was observed between doing an IMRT as standard versus doing with a proton. Similarly, there was no difference in bowel function at earlier time points, from very early after completion of treatment to even at later time points of 4 years and 5 years. That answers many of the questions which we were discussing during the panel. There were no difference was observed in either of the domains in terms of urinary, sexual or hormonal at any of the time frame. No difference in progression-free survival as available at that time frame of 5 years. And there was no sustained difference in any of the quality of life domains or progression-free survival between either of the groups. So this study, PARTIQoL, has concluded that this prospective randomized clinical trial shows that patients treated with contemporary radiotherapy, means by IMRT, for localized prostate cancer achieve excellent quality of life with highly effective tumor control without any measurable difference between doing it with addition of a proton beam therapy. Now there are plethora of trials going on because prostate is a long survivor disease, especially for low to intermediate of the proton beam. So only with time we'll get to know what quality of life endpoints we can boost proton beam in prostate cancers. Thank you.